Okay, so now we're going to perform trach care. So I'm going to be in the client's room, and after I've done their suctioning, I'm going to go into trach care. So I already have my client in the correct position. I've already identified my client, and I've got their oxygen source on, and I just finished their trach suctioning, so I know that their lung sounds are clear. Explain the procedure to the patient, establish the methods of communication, all of that still applies in doing trach care. So for this procedure, I've got my personal protective equipment on. I'm still liking my gloves. And I've got my trach care kit along with the new trach holder because we're going to be replacing that. The client does have a split dressing on. That's going to be in my trach care kit that I can reapply. And then I'm going to need my sterile water for this solution also, and a method to perform hand hygiene. I've got my garbage can here, so everything should be accessible to me. I also have a ambu bag because in the competency it does state that before removing the inner cannula, if my client's oxygenation saturation level is less than 92%, that I would need to hyperoxygenate my client with 3 to 5 breaths before removing the inner cannula. So that's why I have the ambu bag here. Alright, so at this point I am ready to, got my trach collar, I'm ready to open up my kit and prepare my equipment. Let's see, hand hygiene, make sure that I do that. Okay. Always important, first line of defense for infection control. Got my solution here, so I will be ready for that. Open up my container. Now, when I open this up, I have to keep in mind that everything inside this container needs to remain sterile. So as I am manipulating this, I'm only touching the outer edge here as I remove this covering, because everything in here is sterile and we want to keep it that way. Got my garbage can here. Now, in this container, fortunately my sterile gloves are right there on the top, but I don't need them right now. So I'm going to remove them, making sure I only touch the package of the sterile gloves, and put them right here because I'm going to need them in just a minute. As you can see, in this container there are several things. One, which I need right now, is my drape to put down on my surface that is clean and dry and above my waist level. All those principles you remember from first semester about setting up a sterile field. So I'm going to remove that. Remember, I can do that without sterile gloves on, keeping in mind that I only touch the outer 1 inch of this drape. I can remove this. And you know what? If when I'm opening this up, for some reason, let's say I'm not on an edge, which I'm not, as you can see I'm on a fold, I'm going to make sure that this side goes against the table because that's going to be contaminated. Does that make sense to you? So I'm opening this up. I'm not going to freak out that I touched that fold because I just have to keep in mind that's got to go against the table. I open this up. Remember, I touched this back side, so this front side is going to go down on my surface. There we go. Now I have some supplies in here that I need to put on my sterile field. And you remember about adding supplies to your sterile field. Everything in here is sterile. I want to keep everything sterile. I'll put them on there. And they all came out nice and neat, thank goodness. I only touched the back side. Remember, I don't want to touch the inside of here. Now, in this tray, you can see there are 3 compartments. So I'm going to put sterile water in all 3 compartments. So I've checked my expiration date. I've checked for clarity. This has been opened, so remember what we have to do. When we open this, turn my cap up if I'm going to set it down, lip, and I want to pour from exactly where I lipped. I'm going to fill up all 3 containers with sterile water. Okay. So now that I have my sterile water in my containers, at this point I am ready to put on clean gloves and remove my oxygen source. Remember, I can't turn my back on anything. I've got to keep everything in visual field of my sterile field. Put my clean gloves on. And then I'm going to come up here to the trach. Remember, I have to hyperoxygenate my client if their O2 sat is less than 92%. So I'm going to remove the oxygen source, and I'll go ahead and do that, show you how to hyperoxygenate your client. This end is going to attach to the trach. With a trach, the main thing that you need to really remember is to maintain stability of the trach. So I can put my fingers on this flange here, and all this outside is considered contaminated because it's out in the open. And I would administer 3 to 5 breaths to my client. Okay, and their oxygen saturation has come up since I hyperoxygenated them. Now I'm going to remove the inner cannula. Again, I want to stabilize the flange. This has a twist and lock on it. So when you're practicing, you can feel it unlock. And remove the inner cannula. I only want to touch this white part, the clear part we consider to be sterile. I'm going to then place this in the large portion of my water so we can soak, so I can remove crustaceans from there. Remember, have on non-sterile gloves. At this point, I'm going to go ahead and remove this split dressing and assess that, any drainage that's on there, and discard that. Now at this point, I need to put on my sterile gloves. Remove these gloves, throw those away, and put on my sterile gloves. Now, sterile. I can just move that off. I can pick that up later. Now, I'm going to clean the inner cannula, but before I touch that, I want to arrange these supplies on my field for just a minute. Here's an extra holder. I'm not going to need that because I've got a new one. Here's my split dressing. And here are just some 4x4s for cleaning. I also have Q-tips that I'm going to clean with, pipe. We don't use these brushes anymore. We used to clean with those. I won't need those, but I will need these Q-tips to clean, and my brush. Now, when I pick up the inner cannula, I want to pick it up by the lock end. When I say the lock end, that's that white part, not the clear. So, as I'm cleaning this, I want to make sure that I stay over this compartment, because if any contaminants come out, I want it to stay right here. So I want to make sure that I clean the inner cannula, making sure my brush goes all the way down in there to remove any incrustations that are there. Staying over this compartment, using the brush to clean the outside part of the inner cannula. And then I can just leave my brush right there. Now I need to move this cannula over to another section to rinse. I'm going to put that in this next section there. And it doesn't take but just a second for it to rinse. And then I'm going to now pick it up and replace it into my client. Pick it up by the lock end. Can tap it slightly against the inside of here to remove any excess water. Then I'm going to come up here and I'm going to reinsert this. So at this point, everything's just going to be aseptic, maintaining sterility as I put this back in. And lock it. Make sure that it is locked in place. So my inner cannula is back in. Now at this point, what I have left to do is clean around the stoma, around the trach, replace the split dressing, and replace the holder that is around the trach. So I can take my Q-tips. Remember, I've used 2 out of the 3 compartments. So the 3rd compartment is left for your cleaning that you'll do. I can moisten my Q-tips, come here and clean around the stoma. Remember, this is just aseptic. The top part here, cleaning up under and around. Use this one to kind of dry off if I need to, or clean some more. Now the 4x4s that I'm going to take, moisten those. And if I needed to clean on the skin, I could some more, and I definitely need to clean this flange. And remember, I'm just constantly keeping in mind my client's respirations, their color, their O2 sat, and kind of doing a continuous oxygenation assessment while I'm doing this, because they could be compromised even more so than they already are. So now that I've got that cleaned, the next thing that I want to do is replace the holder that is around the client. So here is my new holder that I have, or the trach ties that they may be called. This is in a couple of pieces, as you see. One end has Velcro and this came off. I need Velcro on 2 ends. So I'm going to put this on this side. The little skinny ends are what's going to go up and through the opening in the flange to secure it. So you just adjust this based on your client. Alright, so I'm going to put one end in first. I don't want this trach moving in and out, so I've got to really stabilize this. I'm going to lift up right here and put that new trach tie up under there. This is the tedious part. If I had some kind of tweezers available, that would help. Now, this is my new holder, and as you can see, it is way too big and loose. So I'm going to go ahead and readjust that while I'm here. While I have my old one on, because it's all about maintaining stability of my client's trach. And I need to have about 1 to 2 finger breadths up under here. Make sure it's not too tight, make sure it's not too loose. So there's my new one. Now it's secure. I can remove the old one. Maintain that trach stability. Okay, so I've got the old one off. Discard that, and I'm just going to recheck one more time because that's a little bit loose. See, we have trouble too. I'm going to secure that a little bit more. Okay, so my trach is now secure. Now I'm ready to put on the split dressing. Guess if I had saved one of those Q-tips would come in handy to help slide and guide this new dressing up around the stoma. Alright, so I have a new dressing on, new holder on. I can replace their oxygen source. For this client, it's trach collar. Okay, client's oxygen saturation is good. And at this point, I'm ready to clean up my supplies and then go document my procedure. I'm going to remove my personal protective equipment. Put on some clean gloves. Oops. Clean up all my supplies. Up my gloves and my gown. And go document my procedure. After I perform hand hygiene. Maybe you could slice that together.